I wash my hands before approach to the patient. Introduce myself, check patient identity, and explain the purpose. The choice of venflon will be depending on the size and site of the vein, and also the clinical indication.
Support the limb appropriately and apply the tourniquet proximal to the site of cannulation. Select the vein, preferably on the dorsum of the hand, reserving the antecubital fossa for emergency purposes.
Unscrew the hub of the venflon and keep it in an accessible position.
Sterilize the skin with alcohol wipe and allow to dry. Anchor the vein, checking that the bevel is pointing upwards. Puncture the skin at 15 to 20 degrees. Look for a flashback.
If there is no flashback, you can try changing the direction and angle of the cannula whilst feeling the vein. On models, you may experience difficulty in identifying the vein, or you may not see a flashback even when the needle is in the correct place due to insufficient back pressure. If you're unsuccessful, remove the tourniquet first and use some gauze or cotton wool to stop the bleeding from the puncture site on removal of the cannula.
In the exam, if the blood doesn't come out from the dorsal side of the hand, you can go up proximal to the site and explain to the examiner where you're going to try next.
This was a demonstration of an unsuccessful attempt at cannulation, done intentionally to illustrate the practical difficulties in an exam. In the exam, you should offer to repeat the procedure as shown. Even if you are not given a chance to do this, you should not fail the station for an unsuccessful first try, provided that your approach and technique are good.
Select the vein. Sterilize the skin with alcohol wipe. Anchor the vein, puncture the skin, look for a flashback, and advance the needle for a further 2 to 3 millimeters. Withdraw the internal needle and at the same time apply pressure to the tubing inside the vein with the other hand, in order to control the flow of blood from the cannula. On discarding the needle, place it in the sharps bin. You may wish to take some blood from the cannula using a syringe prior to applying the hub. Flush with 10 ml of normal saline, ensuring that no resistance is felt. If resistance is felt, local swelling is noticed, or the patient feels discomfort, this may suggest that the cannula is malpositioned. Apply the appropriate cannula dressing. Remove your gloves, wash your hands, and dispose of all used equipment.